Welcome to the Aced It podcast, where we turn science into sense. This is season 10, and in this season, we will provide 10 knowledge-packed episodes with the hopes of helping listeners understand what we can all learn from current research on overdose. It's a hard topic to discuss, but critically important information to know. So I am honored that you're with us. I'm Danielle Rudes, your host, and this is Aced It. We begin this season by discussing an epidemic that has plagued the U.S. for many years. You know what it is if you listen to this podcast regularly: the opioid epidemic. The opioid epidemic in the United States is generally considered to have begun in the late 1990s. During this time, we saw a significant increase in the prescription and use of opioid painkillers. Some say this can be tied to pharmaceutical companies' marketing of drugs like Oxycontin as a safe and effective way for managing pain. However, the addictive side of this prescribed narcotic pain reliever was ignored. Right now, we generally define the opioid epidemic as a widespread crisis of addiction, overdose, and deaths resulting from the misuse of opioid substances. The opioid epidemic is fueled by a combination of factors, including overprescribing of painkillers, economic and social challenges, and the proliferation of cheap heroin and illicitly manufactured fentanyl. Addressing the crisis requires a multifaceted approach that includes improved access to addiction treatment, better regulation of opioid prescribing practices, and efforts to address underlying socioeconomic issues. To help you become more engaged in the research on these topics, today we'll discuss a few articles that have examined the opioid epidemic in a number of ways. We'll begin with summarizing a 2018 article titled Charting the Fourth Wave: Geographic, Temporal, Race and Ethnicity, and Demographic Trends in Polysubstance Fentanyl Overdose Deaths in the United States, 2010 to 2021, by Friedman and Shover. The opioid crisis has evolved over the years, and this study examines the trends in polysubstance fentanyl overdose deaths from 2010 to 2021. Polysubstance use refers to the taking of two or more drugs simultaneously. This can be intentional or unintentional. Polysubstance use, particularly involving fentanyl, presents a significant challenge in combating opioid-related fatalities. The research analyzed data from multiple sources to identify geographic, time-related, racial and ethnic, and demographic patterns in polysubstance fentanyl overdose death. They discovered several key findings. First, they called attention to something I already mentioned: geographic trends. The distribution of polysubstance fentanyl overdose deaths varied across the United States, with certain regions experiencing higher rates than others. Understanding these geographic patterns is crucial for targeted intervention strategies. Some of the hardest hit areas include Appalachia, the region encompassing parts of West Virginia, Kentucky, Tennessee, and other states. It has been particularly affected by the opioid crisis. Economic hardship, lack of access to health care, and high rates of prescription opioid use have contributed to the severity of the epidemic in this area. States in the Rust Belt, such as Ohio, Pennsylvania, and Michigan, have also been heavily impacted by the opioid epidemic. Economic decline and the loss of manufacturing jobs have left many communities struggling, leading to higher rates of substance use and abuse and addiction. States like Massachusetts, New Hampshire, and Rhode Island have also seen significant increases in opioid-related deaths in recent years. Factors contributing to the epidemic in this region include overprescribing of painkillers, heroin trafficking routes, and lack of access to treatment for substance use and/or opioid use disorder. Lastly, some of the southern states like Florida, Georgia, and Alabama also have experienced high rates of opioid-related overdose deaths. Issues such as poverty, lack of access to health care, and wide availability of prescription opioids have contributed to the epidemic in these areas. Second, the researchers discuss the issues of time-related or temporal trends. Over the study period, there was a notable increase in polysubstance fentanyl overdose deaths. This temporal trend highlights the urgency of addressing the opioid crisis and implementing effective prevention and treatment measures. The most notable increase in these overdose deaths in the United States occurred in the last decade, particularly around the mid to late 2010s. During this period, there was a significant surge in opioid-related deaths attributed to the widespread availability and misuse of fentanyl. Fentanyl, often mixed with other substances such as heroin or cocaine, has contributed to a sharp rise in overdose deaths across the country. This increase underscored the evolving nature of the opioid crisis and prompted intensified efforts to address the epidemic through various public health interventions and policy measures. Third, the study examined differences in overdose deaths among different age, sex and gender, and racial and ethnic groups, with a specific focus on race and ethnicity. Understanding these disparities is essential for developing equitable public health interventions. Historically disadvantaged racial and ethnic groups have faced barriers to accessing healthcare services, including treatment for substance use disorders. We've covered several studies that examine this in prior episodes of this podcast. Limited access to healthcare may result in delayed or inadequate treatment for substance use disorder, increasing the risk of overdose death. Economic factors such as poverty, unemployment, and lack of education disproportionately affect certain racial and ethnic groups. These factors can contribute to higher rates of substance use disorder within these communities, leading to increased overdose death. Overall, this study sheds light on the complex nature of the opioid crisis and underscores the need for comprehensive approaches to address polysubstance fentanyl overdose deaths. By understanding the geographic, time-related racial and ethnic and demographic trends, policymakers, healthcare professionals, and communities can work together to mitigate the devastating impact of the opioid epidemic. Next, we'll turn attention to a 2021 study by Serta and colleagues. Here, the researchers highlight several key social and behavioral factors that led to the opioid overdose epidemic. First, they emphasize the role of social determinants of health, such as poverty, unemployment, and lack of access to healthcare. These factors create environments where substance use disorders thrive. Additionally, they discuss the impact of social networks and peer influences on substance use behaviors, arguing that individual behaviors such as substance use are influenced by social norms, attitudes, and experiences. For example, stigma surrounding substance use can prevent individuals from seeking help or accessing treatment, another topic in a prior episode of this podcast. Further, social networks can either support or discourage substance use, depending on the norms within those networks. Building on that discussion of social and behavioral contributions to the opioid crisis, 2 additional articles shed light on key trends and substances fueling the epidemic. The first article, by Friedman and Shover, examined the evolving landscape of polysubstance fentanyl overdose deaths from 2010 to 2021, further highlighting geographic, temporal, and demographic patterns. Their research discusses the interplay of factors driving this deadly wave of overdoses, such as the drug markets that are dominated by illicit fentanyl, making polysubstance use more common and more desired. Meanwhile, in a separate study by the same authors, they explore what led to the spread of synthetic and polysubstance overdose crisis. Any guesses? Well, it's actually xylazine, a veterinary tranquilizer that has been investigated across the U.S., and is a growing component of the overdose epidemic. These studies underscore the urgency of understanding the multifaceted nature of the overdose epidemic and the need for comprehensive evidence-based interventions. So, why and how does this matter for policy, practice, and public health officials? Well, many of these studies highlight the importance of addressing the social determinants of health and implementing evidence-based interventions at both the individual and community levels. This includes expanding access to healthcare and substance use treatment, implementing harm reduction strategies, and reducing stigma around substance use disorders. Additionally, this science emphasizes the need for policies that address structural inequalities and promote social support networks. It is well past the time for us to sit on the sidelines and read about or watch people die. These deaths are preventable, but preventing them by reducing and or limiting the opioid crisis in the United States is complex. Perhaps it is the complexity that makes us resort to inaction. We're overwhelmed by what is happening and we don't know how to stop it or slow it. I hear you, but I leave you with this quote by the late Ethiopian Emperor Haile Selassie and a final call to action. Here's the quote. Throughout history, it has been the inaction of those who could have acted, the indifference of those who should have known better, the silence of the voice of justice when it mattered most, that has made it possible for evil to triumph. Thank you for listening to the Aced It podcast. We love hearing from you. So if you have comments, topics to suggest, or some science you'd like us to cover in a future season, please write me, Danielle Rudes at Sam Houston State University. My email is drudes@shsu.edu. And as always, thank you to the Justice Community Opioid Innovation Network, or JCOIN's Coordination and Translation Center, funded by the National Institute on Drug Abuse, housed at George Mason University, where this podcast originated. Thank you to our fabulous scriptwriters, Dr. Chelsea Narvi from Sam Houston State University and SHSU master student Jalen Magana. And a huge and heartfelt thank you to Jason Luchin and the team at Slonky LLC for their wonderful production, as always. Tune in again soon for another episode of Aced It.